Hey there, everyone. My name is Noelle Escovedo, and I'm the clinical director here at Devereux California. And today we're doing a training on person-centered thinking, trauma-informed care, and PBIS. Mostly we'll dig into PCT and TIC. Okay, so I'm going to share my screen and we shall get into it. Alrighty. So just as an introduction, many of you already know me. I've been in this field for 20 plus years in all sorts of different parts of service delivery. I've been in program development, conference speaking, foster families, all different ages. And very early in my career, I realized that I'm going to be a lifetimer. So I just urge you guys to dig into the science of applied behavior analysis and get to know the things related to this type of work because it's an incredible work that we do. Okay, so we're going to do a little exercise about person-centered thinking. Now, person-centered thinking takes a look at what is important to and what is important for an individual, okay? Important too, and by the way, as we're doing this training, I want you guys to take notes, have a scratch piece of paper, and really be thinking about the main concepts here. And I want you to be able to kind of retain what is PCT, important to, important for. How do I use it? When do I use it? What's my responsibility? I want you to think like that. So person-centered thinking is something that we do to ensure that the person is the center of their care in all sorts of different parts of programming, okay? It teaches us how to get to know our individuals and what questions to ask, how to interview them, and how to really ensure that they're thriving, right? Devereux is a very different organization. We are not just here for room and board and to keep our individuals safe. We want to make sure that they're thriving and honored. So we want to get to know what makes them tick. And person-centered thinking, like I mentioned, we look at what's important to and important for. By the way, you guys will have a little exam that goes along with this training, and that will need to be turned in. So make sure you take a look at it ahead of time, and you can answer these questions throughout. By the way, you want to really memorize these answers because they're important to the work that you do. So important to and important for. Important to is all about what are the client's interests, preferences, their favorites, their aversions, things they like, things that they don't like. And you really want to consider all sorts of different things. And I want you to sort of think about what you like for yourself. Things that make your morning routine, afternoon routine, and evening routine either not so good or just a few different ways to make it a little bit better. And there are probably a couple of really special things that make it really wonderful and awesome. And there are probably various things like that related to how to make sure your weekends are amazing. Your, again, early mornings, your holidays, your sick days, your birthday, um, things that, are your preferences. And so, what we're going to do through this good week and bad week exercise is examine what things go into your week that lead to you having a really, really great week or not such a good week. Big and small, we want to think about huge things like I did this really amazing goal. I went to this wonderful place. Or even small things like I wore my snuggly socks and it made me feel cozy. Okay. So we're going to do that exercise. We're going to talk about trauma-informed care and how it relates, how knowing someone's history and their triggers and their challenges and their traumas affect how we show up for them. Things that we avoid, things we say we do with our actions and our support that make our individuals feel more safe and less re-triggered and re-traumatized, given the history they've experienced, okay? So let's jump into it. We said PCT focuses on important to and important for helping our individuals have a higher quality of life. So let's think about this. I'm actually going to pause this recording so we can do a little typing here. Alrighty. So I want you to think about if you had, let's just imagine you had a great week. And I want you to think like, wow, you were so fulfilled this week. It was an awesome week. What were some possible things that could have happened in a week that is a good week? I really want you to take a minute and write this down on a scratch paper. Um, I do this with every single staff that comes our way in every program, and I have them write this on a whiteboard. So some things that people say is I spent time with my friends or my family. I had my favorite Starbucks coffee or a matcha, or I was able to wake up early enough to have my routine where I have my favorite hot tea, I put on my snuggly socks, I light my candle. Some people have routines and rituals. Um, some people love to be in nature. They get up early enough, they're able to take a walk. For me, I have a great week if I'm able to exercise like a few times a week. Some people love to pray and meditate, do yoga, exercise, go to the gym. Some people have religious practices or some other fun routines. Another piece of being person-centered is cultural competence and cultural sensitivity, right? The things that we love in our culture. For me, my dad is Japanese, and so if I'm able to wake up and cook my morning miso and have a hot green tea and do my morning routine, I feel like I had an extra good day and an extra good week. Um, some people have said, hey, I got to go surfing. I spent time in the ocean. I drank out of my favorite mug. I wore outfits that made me feel good this week. Some people had time alone. That fills up some people. They need time to recharge. Some people want to be around a lot of people. So I want you to think about it. What are some things that lead to you having a good day and a great day and a great week? List a couple of big things. Wow, I achieved this major goal. I got a raise at my job. And small things. Um, Someone praised me for something great that I did. I was able to help someone in need. So let's write that down. I was able to help someone in need. And again, small things as well. We wrote down had hot tea in a favorite mug. Little things. In one training, someone said, I bought myself beautiful flowers. So as soon as I wake up in the morning, I have this beautiful aroma of flowers. But whatever leads to you just going, ah, and feeling refreshed. Okay. If I have a clean and organized space, that helps me to have a good day or a good week. And then how did that make me feel? Jot down a few things. How did that make you feel if these things happened? Well, I might feel happy, refreshed, relaxed, calm, supported. What are some other ways that you might feel if those little person-centered things are included in your week? You might feel empowered. Okay, so take a minute to write that down. Next, and feel free to pause this video as well. Next, we're going to switch over to, gosh, let's say you had a bad week. I'm sure we can all think in the past couple of months, maybe there was a week that was just totally overwhelming. Things did not work out right. Little things and big things. And this is very personality dependent, right? This depends on what matters to you. What is person-centered to you? For example, some people love to be around many people. Some people want to be at concerts and do fun things. And other people, like me, might be very introverted. And I don't like to be around too many people. That could leave me feeling very drained and overwhelmed. I like to have alone time and quiet time. So it's very person dependent. And if someone assumed, wow, Noelle's kind of bubbly sometimes, let's make sure we throw her a big party and do all of these things and we're going to have lots of people, I would probably feel very exhausted by the end of the week. That actually wouldn't suit me. So you need to ask questions, right? And get people thinking about it. What really does help me have a little bit of a better morning, afternoon, evening, sick day, holiday. What are the things that help you? What de-escalates you? What relieves stress for you? It's different from one person to the next. And you have to get to know people to find these things out about them, right? In order for you to support people in a person-centered way, you need to get to know them. So let's think about a bad week. Let's say you had a totally bad week. These are some answers that people have given me in our trainings. They might have had financial issues. They felt confused throughout the week with no support. That could have been in school, with an exam, with a new job. They had to study for a difficult test, one person said. For me, something that leads to a not so great morning is if I'm rushing. Let's say I didn't get good sleep or I wasn't feeling well, which of course that depends on my nighttime routine. But if I didn't sleep and then I wake up late, I feel very chaotic in my mind, and that does not work for me. Now, you wouldn't know that unless you asked me, hey, what affects your morning, right? So for me, if I'm rushing all the time, that does not work well for me. If I didn't exercise, some people have said if they don't meet their goals, if they had no alone time, if they didn't sleep well, felt sick, some people have said, felt lonely, okay? And these are some of them have some overlap here. I put some of my feelings in my bad week section. But how would you feel if these things happened? Maybe I wanted time with friends, but I was too busy. Ooh, okay. And then how would it feel if these things happen? Well, in comparison to my good week of feeling happy, refreshed, and relaxed, I might feel drained, tired, overwhelmed, anxious, disappointed, depleted. And if these things are ongoing, right? If someone feels lonely for too many days in a row, or unsupported for too many days in a row, or fearful about upcoming events or things that they can't predict in the future, they could feel sad, angry, depressed. And if that's not relieved after some time, what the literature shows us, at least for our population, is that there's multiplications more depression, chronic stress, even suicidal ideations when people do not have these things relieved after months and years, so on and so forth. Okay, so now we're going to take a look at what's called a one-page profile. We try to create a one-page profile for every single individual that we serve. Everyone has one currently, so you can always ask your program manager to see their one-page profile. Now, this is a tool used in PCT, person-centered thinking. And the tool, the one-page profile, the whole point of it is to talk to the individual, get to know them, and really capture their voice, as you can see right here, capture their preferences, interests, aversions, best ways to support them. And it's something that can travel with them. It can go to the doctors. It could be at the front of a treatment binder. Um, and the purpose of that is even used in training other staff so that we're not talking about people in a way that we're like, okay, their main behaviors are XYZ. Here are the problems. Here's the tough stuff. But instead, we want to talk to our folks and about our folks with respect and dignity and really focusing on the person. So what we're going to look at here is a sample one-page profile. The term one-page profile is a familiar term for people who've been in this field for a while. So let's take a look. usually involves a picture of the person. We make it colorful. Sometimes they color it, they draw on it. Depending on their skills, you really want this to be something that they own. Sometimes our folks like to put it on their wall, put it on their door, take it with them to a new job or school, or even just share with their family. It often has well, it always has their name, age, a little picture of themselves, and what people appreciate about me. And so we might write in here, um, Johnny says that he's really funny. People like that he's handsome, he's cool, he's smart, he's really good at soccer. We want to find out what are the things that are special about that individual. And you can help them kind of come up with these ideas. Because to be honest with you, people who have been in care for many, many years, they don't always know what people appreciate about them. They don't know what we find so special and so cool because historically, um, people who work in these types of environments have not been great at using person-centered language or treatment planning. So we're changing that now. So they sometimes need your help to identify how to answer some of these questions. So the next thing is, what is important to me? The little note here says, add my quotes, my dreams, wishes, aspirations, favorites, favorite food, clothing, places to go, how I like to look, how do they like to present themselves? How to make my morning, day, or evening routine even a little bit better or special. Am I a morning person or not? How can team members support me during certain routines, sick days, holidays? What are their goals, preferences, aversions, things they don't like? Their pacing in life. Some people are very fast paced, some people are very slow paced. Spiritual practices, cultural traditions. Again, what traditions and routines do they have that maybe they had in their family or that they observed with their parents? Culturally, what type of foods? What do they like to wear? Where do they like to go for their culture? And activity preferences, people, relationships, the level of activity. Do they like physical things in sports and nature, or they like to really be indoors reading a book? And how do they like to be valued and treated? Music, what do they like to listen to? How loud, how often? Imagine getting to know those details about the people we serve and how honored they would feel. And then what's important for me? So important to me is about their wishes, preferences, aversions, things they like and don't like. Important for me is about their safety and independence. What skills are needed for them to be more safe, more independent? Or what skills do they need to help them be more of a community participant? What behaviors do they need to work on that are maybe interfering with the quality of their life? Okay. And so the important to me section is often really their voice. And the important for me section is sometimes where the conservators or team members will jump in, or mom and dad, and say, oh, we need to work on this skill because he's not able to go to the school he wants because he has the little difficulty that he needs to work through. So you want to consider things like hygiene, medical supports or medical routines, nutrition, social interactions, community outings. What skills do they need to learn to be more successful in those things? Okay. And then sometimes we'll have a last section that is how best to support me. And here we're looking at triggers, precursor behaviors. Are there any particular setting events like, hey, if so-and-so does not get enough sleep, here are some behaviors that you will see the next day. Or if, you can think of various things. We wouldn't want to put something super sensitive on a one-page profile, but it is important to get to know an individual. Like perhaps we know about this person that if they're in hot weather, they're going to start banging their head against the wall. If they're not hydrated properly, we might find out if this person doesn't get enough attention, you're going to start to see some increase in behavioral challenges. And a little note here is, what do these behaviors mean and how can they be misperceived? What are the best ways to build rapport? We have individuals that every year, 2 weeks before their birthday, they start having difficulties. because in their history, from a trauma-informed perspective, they had very difficult birthdays. Because they had behavior problems, relationships were very strained between mom, dad, the family, and siblings, and birthdays were a very difficult time as well as holidays. Um, did I already say BMs? We don't want this written on a paper, but again, BMs. If some people don't have a bowel movement a couple of days, you're going to see behavior problems. It could be any number of things, okay? Now, I want to take a minute and just discuss how to build rapport. So that one-page profile gives you a little bit of an outline of how to get to know people. Oh, you know what? I wanted to show you guys another page that's a little bit more filled out. So in this example, take a look at this. What do people appreciate about me? I'm funny, I'm loving, I'm helpful. What's important to me? I love drinking Coke. It reminds me when I was a child. I like mashed potatoes once a week. Um, and so we know if we only give mashed potatoes once a month, that does not feel as fulfilling, right? I like to make jewelry. So then we have to think of materials and funding. We need to have jewelry. How often do they need to repurchase more materials for jewelry making? They want to work at McDonald's someday and have a boyfriend. What skills would be needed for that to happen? And sometimes we think, well, maybe someone does not have enough skills. We never want to assume they can't do something. That's not really our role, but we can practice these skills no matter what and make them feel empowered and give them something to look forward to. Okay. Routines. I like a slow pace in the morning, no rushing. I like to watch my favorite show, Judge Judy, at night. Imagine if someone doesn't get to know a client and every morning they rush in their room and they're rushing them, come on, we got to get up, let's go, we got to have breakfast. And then at night they're going to take a shower instead of letting them watch the show at a certain time that they want to watch the show at. So it really takes understanding the individual, timing, pacing, all the different aspects to make sure that they're served in a person-centered way. Okay, now take a look at this. Snuggly socks every day when it's cold or it's the holiday season. I like to have deep talks with my team every few days or I get lonely. So this particular person doesn't want to just talk about the weather and have shallow conversations. She wants someone to sit with her and discuss politics and what's happening in the world and how she's feeling. That makes her feel like she's contributing and cared for. So quick story here, tradition. Um, I like to dress fancy on Saturdays and get my hair cut at a hair salon every 3 months. I love turkey and stuffing on Christmas. That takes a lot of coordinating to understand the nuances of people, how people want to be treated and what they want to do with their time. So quick story time. I had to do a person-centered thinking survey for all of our individuals, and I went to interview this one gal at our Wiseman Center. And so she knew we were going to do the interview. She knows me well. I walk up to her and I just observe, I take note that her hair is very messy. She's still wearing her nightgown. It's kind of the middle of the day. And that's lovely. To each his own, totally support. But hear me out. When we got started talking, I said, so what do you like to do? And she started mentioning, oh my gosh, I love the beach. And I said, tell me about your childhood. What are some cool memories? And she said, well, I'm very well traveled and I feel like I should be respected for that. I've been all over the world and many people don't even know that about me. And so we started talking about the places she's been to and all the different beautiful cruises and places she went on vacation with her family. And I said, wow, wouldn't it be cool to see those places again? Now, by the way, I happen to know we have virtual reality services that sometimes our individuals can participate in, and they can almost tour anywhere in the world and go to like the street that they lived on. And so I'm trying to think of like, gosh, what could we do? Could we print pictures? Could we look up facts about Italy? Can we I mean, what could we do? Can we turn this into a game of matching different cities or, whatever it is? Did she drink coffee? What can we talk about to just expand that window of life and make her feel honored in those memories, right? Anyway, as we continued going, I said, tell me about how you like to present yourself. How do you like to dress? And she says to me, well, I'm a very fancy woman. And I thought that that was so interesting. Why? Because she's sitting here still in her nightgown, hair not really brushed. And she says, I love to wear makeup and have my nails done. I said, oh my, how often would you get your nails done? She said, oh, I'd love to do them every week. I said, what color would you do? And she said, I would wear red lipstick and red nail polish. So let's look at this here. We've got a woman who is not really, hair is messy, wearing her kind of nightgown, but she really likes to be fancy. Now we can ask more questions, right? Well, how do you feel when you dress fancy? Do you always like to dress fancy or do you sometimes just like to be in pajamas? I'll say for me, I like to be super fancy sometimes, and you will catch me in sweats and a baseball hat any weekend you find me. And so she ends up saying that she really likes to get dressed up. And so it posed the question to me, is this something that we might have missed? Could this be a day where people are like, okay, time to get up, let's get out of bed, and someone didn't know what was person-centered for her? Okay, do you want to get dressed? And the other thing I want to mention here, guys, is that sometimes our folks are so used to the like routine and the humdrum and the nothing is going on, nothing exciting, that they forget that they can be empowered and feel proud of how they look. And sometimes it takes one staff going, hey, did you want to dress fancy today? Well, let's pick some. I know you love red. Would you like to get some makeup on today? Can I help you with that? How can I support you? Do you want to go shopping? I mean, I don't care if they want to wear a ball gown. Sometimes we have to lead them through discovering what makes them feel the best about themselves because they may not know. Okay, now traditions, religion. Maybe they go to mass, maybe they go to church. Maybe they like to watch on the TV or listen or attend a service. Maybe we can invite someone from any religion to come and share and do a little group, right? Culture. Do they like to eat their favorite childhood Korean food, kimchi? How are we going to get that? How often? What does it go with? Is it safe in their diet? We have to look at all those things. And as I mentioned, important for me, we're going to list some things. What do they need to practice for safety and independence? In this one, it says I need to practice deep breathing every few hours to stay calm. And I need prompts to take my medication. Now, this section might be pretty extensive. And it could say, hey, I need to practice calming and coping skills every 2 hours throughout the whole day. I need to look at my menu of calming activities, which include listen to soft music, sit in the massage chair at day program, take deep breaths, do yoga, read my social story and daily affirmations about how to have self-control, take a walk. This could involve so many different things. And then how best to support me. Okay. So as an example, this says, if I seem grumpy, am I still sharing? Yes. If I seem grumpy, it might be because I didn't eat or sleep well. Help me to meet any unmet needs. I need to practice communicating when I need help or feel lonely. When I start pacing and repeating, it's just a hard day. It's just a hard day. This actually means I need to take a break or I might get more frustrated. New staff can be a trigger. Let's build rapport by playing cards and laughing together. Okay, now let's take a look at how to build rapport. How do I build rapport with the individuals we serve? First of all, I want to say to you guys that you are here for a very important reason. We don't just hire anybody. We hire people that are very, very special. We want people who are going to go the distance. And we want you to plant your roots here and excel. Devereux is an incredible company, the best that I've ever worked for. And my point in saying this is that this is not a summer gig. This is a career. And there's so many opportunities for you to advance. Your manager will hopefully be talking about career paths with you because you literally hardly need to get another job ever again. The entry-level positions are worth it to excel in this company. It's so awesome. I wanted to say that to say, come and bring your best. This is very important work that we're doing here. We're working with folks that are very much underserved in terms of quantity, quality, services available. Many people want to line up and work with tiny little kiddos who are a little bit grumpy, and they've got a lot of services available to them. But then they grow up, and then they get older, and then they're aging. And they need inspired, energetic, creative RBTs, registered behavior techs, and direct support professionals who really want to inspire our folks to learn, who want to learn about the sciences to be effective in teaching them and building skills for our folks, okay? So not a summer job. When you're here, we want you to walk in excellence. As you know, we're all servant leaders here. So I want you guys to watch people, supervisors, managers who are great at a thing. Wow, this person, Monica, is amazing at relating to our individuals and caring for them or responding to their needs. I want to learn how to do that. Wow, this supervisor is amazing at leadership, organization, presenting, professionalism. Let me exude that. Wow, this staff person is energetic and creative and always talking about PBIS and be safe, responsible, respectful. I'm going to do that. So observe that next level that you observe someone doing a really great thing and emulate that, okay? As you know, our mission is, do you know our mission? I'm going to pause this video really quickly. Our mission is to unlock human potential. Now, as you work here at Devereux, you will not only learn through PBIS how to unlock the human potential of the folks we serve, but also your own human potential. Okay, you will grow in leadership, in organization, in your discipline, in research, in your understanding of the science, and execution and implementation. There's so many brilliant things to learn here, and we expect that of you. So, how to build rapport. When you're getting to know our individuals, I just want to say, what is going to be your channel or your pathway to connect with each individual in a unique way? Now, remember, you want to build rapport in a way that is trauma-informed and person-centered. So you need to get to know them, find out their likes, what makes them smile, what makes them giggle, what ticks them off, right? What are their boundaries? What's their history, their trauma history, their triggers, things we should avoid? How do we take caution around safety? What are their needs in the environment? How are they going to feel safe and supported? Okay. So what will you do with this individual? How will you talk to them? How will you look in their eyes? How will you support them in their wheelchair or with their lunch, with their morning routine, evening, holiday, sick day? That will establish your relationship as trustworthy, fun, and friendly. Once you have this positive relationship developed, you'll be able to inspire the individual to learn important life skills. From that foundation, anything is possible. Now, you'll be able to de-escalate behaviors and impact their quality of life. So, how are you going? Let me say this. Guys, if you're new to this field, it's going to be uncomfortable. I would encourage you to practice how you talk, facial expressions, even in the mirror, even if with your friends and family, but certainly as you're getting to know our individuals. It might feel a little awkward at first because the folks that we serve are so diverse. That's the beauty about it. Some of them are you have a lot of communication skills and they're funny and chatty and overly talkative and just all sorts of things. Other folks are non-vocal. They don't even look in your eyes. They flap their hands. They might be engaging in self-stimulatory behavior. Some of our folks look completely disgruntled and grumpy. Some of them might be drooling and they have different care needs. You might find some in a wheelchair. Various folks have different disabilities, physical challenges that you will have to work through. And some of our folks, socializing is interesting because you and I, we for the most part know how to socialize, and we reinforce each other, we nod our head, we smile, but some of our individuals don't know how to do that. And so you might have to practice talking to them. Let's say you're back here and the individual's not looking in your eyes, flapping their hands, rocking back and forth, looking totally disinterested, but they're listening. And inside, they're appreciating that you're trying to relate to them, even though they're not giving you any feedback. And you might read in their record, be careful to not approach them from behind because they have a severe trauma history and they don't like to be surprised. Or you might find out that from their records that they like very calm and slow pacing and talking because they get overwhelmed very easily. Okay, so how will you know that you are successfully building rapport in a trauma-informed and person-centered way? Well, you've gone through some of the questions in a one-page profile, right? You've found out what's important to and for them. What are their likes, preferences, history, aversions, their favorite memories, things they don't like. You've read their records. You've asked managers about how to keep them safe or how to avoid re-traumatizing them and what their trauma history is. So you're informed. And you're probing different things. You're probing different games. You're trying to find out what kind of conversation they like to have, what topics they're interested in talking about. So how will you know you're being successful? Well, the individual wants to interact with you. They smile when you arrive. And remember, some of our folks their facial affect does not match how they're feeling. So sometimes they won't smile and they're still very much appreciative of you being there. You develop a fun routine, right? Every day you walk in, you're like, okay, hey, good to see you. Yeah, we're going to get your favorite lunch. And then remember, what do we do after lunch? Painting, boom, right? It's different things like that. You develop a fun routine. You can make them smile, laugh, or perhaps they don't have those physical confirmations that they're having a good time, but they will work alongside you. They'll do a parallel activity. They will cooperate with requests. Can you hand me the purple crayon? And even cooperate with harder tasks because you've developed trust. They might take turns with you on something. You might be able to say, okay, great. Can you pass me the scissors? Awesome. Oh, yeah. Good. Now pass me the glue. Thank you. Okay. Did you need this purple crayon? You're now you have a reciprocal interaction. And then you're able to say, hey, can you grab that Clorox wipe and you wipe that side of the table and I'll get this side. Check us out. Look, great job cleaning. Now you just gave a harder task and they're reciprocating and cooperating and responding. And you might come into a program and you notice them go, they look at you and they rock back and forth. The indication might be that small. Let me say this. Any onset or offset of behavior gives you information. It's communication. So if you walk in the building and then they're in a wheelchair and they suddenly rock back and forth, you can even say to them, hey, I saw that you saw me when I walked in. Are you excited I'm here? Right? You can be silly with them, with some people. Or maybe that rocking means, oh no, there's this chick here who pesters me. Could mean they don't like it. Now, let me say this. Because some of our individuals are used to not having to engage or interact or do many activities, as you're increasing their quality of life and introducing them to new things, sometimes they're gonna grumble at first. It doesn't necessarily mean stop. So hear me out on this. There's a balance between being person-centered and honoring someone if they say, no, thanks, I don't want to participate. There's a balance between that and also teaching them new things and leisure skills that will lead to them having a greater quality of life. So sometimes you'll say, oh, I know you don't want to do this. How about you paint with me for 2 minutes? Okay, fine. And you set a timer and then you're like, wow, that's beautiful. Check out your painting. Oh my gosh, Monica, did you see this beautiful painting that Susie made? And then suddenly they're receiving so much praise and their contact, you invited them to contact reinforcement in a new way. Now they're feeling dopamine and serotonin, all these positive chemicals are happening in their body, and they're like, hold on. Maybe after 2 weeks, I do like painting. Suddenly they've been introduced to a new leisure skill that they can do with other friends. And, they can do that their whole lives. So just because someone says, like, I don't want to do this, doesn't mean we drop everything. We say, she never wants to do another activity again. We respect their wishes. Okay, let's not do it today, but tomorrow maybe. Can you give me 30 seconds? Can you just color? I already put glue here. Can you put one cotton ball on there? Bam, thanks for helping. We think in our minds, how do we get them to participate slowly over time? And we start with really motivating, simple things that they love to do. And then we're adding duration, adding time, adding complexity, adding participation, adding more friends so that they eventually learn a new skill. Okay? So we are talking about how do we build rapport in a trauma-informed and person-centered way. Okay, practice getting to know an individual who is verbal or nonverbal. They might be in a wheelchair. They might only whisper when they talk. You'll have to practice understanding someone's language and communication sometimes. We have some of our folks that do a lot of miming and gestures. We have some of our folks who don't. We have some of our folks who have tics and they just randomly yell profanities, just unintentionally. We have individuals who are super funny, who are super quiet, who have a major trauma history and are very reluctant to interacting. So they all require very specific strategies that you have to explore. Praise often. You want to have an enthusiastic tone of voice and facial expression. Draw them into interactions that allow them to contact more reinforcement. If someone just sits there and does nothing all day, it's a little bit difficult to praise them in a variety of ways. Great job sitting there. There are things you can say like, hey, did you pick out that outfit? Nice job. Wow, great job being independent in that. I can see that you're being so safe here at lunch. Are you helping and sharing that with your peer? Wonderful job. Those are things to say. But also, if you can encourage them over time to do additional activities that they receive different types of praise from various people, that drastically impacts their quality of life in a positive way. Some people do not like very animated vocal expressions and affect. As you can see, I'm quite bubbly, and I definitely have individuals in the past where when I was younger, I thought that was like the only way. I'd show up at people's houses and be like, okay, let's play or let's hang out with younger guys. And I had one individual who was like, oh, and like ran across the couch to get away from me. So, point being, start off warm and inviting and enthusiastic, but check out their body language and facial expressions. You can even ask them, it might be too loud. Should I tone it down a bit? Okay. Let's see, draw them interactions that help them to contact more reinforcement. When people are walking by or peers are walking by, you can say, did you see this bracelet that Susie created? Look how beautiful. Wow, check out the stone she picked for this. Look how she twisted that wire. Oh my gosh. Talk to them like an adult, not like a child. Become a conditioned positive reinforcer. What does that mean? That means pair with something that they love. They already love painting. You want to pair yourself with that. They already have a positive relationship with the program manager. Pair yourself and do activities with them. Then they will associate you with positivity. Identify what's important to them, who and what. What are their reinforcers? How do they like to be valued and treated? What activities do they like? So when you're building rapport, think board games or card games, certain TV shows. Do they like bingo, arts and crafts, exercise, indoor activities, outdoor activities? What do they like to talk about and for how long? Do they like to talk about their child, going to Paris, train rides, And maybe they burn out after like 5 minutes, and you'll start to know that. Practice interviewing, getting to know our individuals for 2 whole minutes. And you want to be able to expand that to 15 minutes, right? Our individuals have such short pieces of communication. Good morning, you ready for lunch? That type of thing. You want to expand and make it more natural, like the conversations you prefer with your friends. Okay, probe new activities that are within their capabilities and that are safe for them. All right, we talked about the one-page profile. Consider this, when they get dysregulated, what helps to calm them down? You can ask them, other team members, and people who've known them for a long time, service coordinators, their conservators, you can read the records. Observe how they dress and how they like to dress. Maybe you look at magazines together. You point it out on TV. Do you like his hair? Do you like his cool shoes, his jeans? Things like that. Okay, those are some little tips on how to build rapport in a person-centered and trauma-informed way. Okay, so let's talk about the population that we serve. I'm going to go ahead and share my screen. Okie doke. So we serve a number of different populations, mostly individuals with intellectual disability and autism spectrum, but we also have folks with dual diagnosis, mental health challenges, Down syndrome, the gamut. A little bit about each one of these. So folks with IDD, it's a condition characterized by significant limitations in both intellectual functioning and adaptive behavior. And we're going to look at another couple of slides about that. We also have ASD, autism spectrum disorder, usually appears before 3, and it impacts normal development in the brain areas that are responsible for social behavior and communication. Okay. And we often see excesses and deficits in those areas. So you could be very, very overly social and miss all the social cues or avoid social interaction. You could be very, very overly communicative or be non-vocal. And sometimes we'll see poor eye contact, hypersensitivity to sounds, smells, and things that they're touching, difficulties with emotions, extreme interests, repetitive interests on one particular topic. So they might overfocus on trains or gas stations or aviation. It could be any number of things. Involuntary and repetitive noises. You might hear someone go, I, and they'll say the same thing over and over. They might script and repeat phrases or have echolalia. So you say, hi, how are you? And they go, hi, how are you? And they sort of mimic what they heard. They might have self-injury, aggression, repetitive movements, or self-stimulatory behaviors such as rocking, hand flapping, finger play. And of course, they could have comorbid or dual diagnoses and have additional health challenges that relate to these diagnoses as well. So there's some vulnerabilities and some risks for individuals with intellectual disability. There's a high prevalence and a higher risk of experiencing mental health conditions like depression, anxiety, bipolar disorders, as well as stigmatizing attitudes and a lack of training among healthcare professionals, even doctors. It's very difficult to get to some pain or some difficulty that our individuals are experiencing because folks do not know how to interact or support, especially if there's a mental health diagnosis with our individuals with ID or ASD. There's some behavioral issues. There's communication barriers, which can make it challenging for individuals to express their needs and emotions effectively and get the support that they need, as well as a very high prevalence of trauma and adverse experiences. Disproportionately to the neurotypical population, they experience financial traumas, social traumas, physical and sexual traumas as well. There's barriers to care for our folks. I alluded to that briefly. And our individuals really heavily rely on caregivers and you all to get their needs met. Alrighty. So let's take a look at this slide, which looks at IDD and ASD. Okie doke. So you can see on the left, IDD has deficits in reasoning, problem solving, planning, judgment, and the ability to learn through experiences, to learn kind of promptly. For autism, there's excesses, we talked about this, behavior, social communication, insistence on sameness, and inflexibility with routine changes. Now, some things they sort of share are executive functioning, okay? So executive functioning is the ability to plan, predict, consider an outcome, and really just sort of organize and think through a thing. And people who are neurodivergent, even ADHD can experience some challenges with executive functioning, which creates some difficulty there. But for folks with IDD and ASD, what that looks like is the world is very unpredictable. And it's difficult for them to kind of be patient and work through and think through and predict. And I don't have to overreact because when I did that last time, here's what happens. And I can think ahead and manage the best choice. That's all very complicated for the folks that we serve. Additionally, they might have sensory processing issues, as I discussed. So just to talk a little bit about this, you and I are not distracted by what's going on in the environment for the most part. You guys can filter out what is important. You're not distracted by, if there's a slight humming of the lights or something's fluorescent or your clothes being itchy or even the lines intersecting at 100%. But the individuals we serve can potentially experience all that stimulation, just competing with each other. So sounds, what they see, textures that they feel, thoughts, emotions can all feel very, very, very overwhelming, feeling cold and feeling hot. Their learned history creates some patterns and habits, right? So if they were previously unsupported or they learned that screaming and kicking immediately gets their needs met, then that's created a possible pattern and habit over time. Learned helplessness. If they feel like they're always failing at something, they're not good at social interactions, they've got received a lot of criticism for trying to do a thing, or people have judged them and made them feel poorly, they might experience learned helplessness where it's difficult for them to give something a try. They might have negative associations with doing something in the past. Again, socializing, medical routines, having conversations, which creates negative associations and it creates a stress response when trying to do it the next time. And with all this difficulty of executive functioning, trauma history, poor previous experiences, perhaps they were not handled very supportively by a previous family member, caregiver, or staff, hopefully not at Devereux, then there's just, some challenges and some difficulties with that. And they need more predictability. And some would even say that there's a failure to manage uncertainty. So ways that we can help, and that might be on the next slide, is that we can increase predictability in their routine. Okay, so one thing I want to tell you is that when our individuals are engaging in some undesired behavior, if they're doing it, it's working for them. Maybe not for everyone else, but let me explain. Our individuals will do whatever is the most efficient and effective to get their needs met. So if they learned banging their head against the wall makes everyone get out of the way, and that's what they desire or want, they will do that. If they learned breaking things make people run to their attention to get their needs met, they will do that. So unfortunately, although some of these behaviors are challenging, oftentimes the environment and people in their environment have inadvertently trained them to continue engaging in this behavior to get their needs met. So our job is to teach them a more appropriate way to get their needs met, such as instead of banging your head against the wall, tap on someone to get your needs met. Say, I need help. And number two, slowly teaching the appropriate responses to the environmental demand. So when XYZ is going on, I will do XYZ. If I want to go on a van ride and access is denied, I can say, oh, darn, I'm really bummed out, and choose from different activities instead of completely having a meltdown, as an example. So here's a quick, brief slide on a difficulty that our individuals might experience and some support solutions. They might have trouble with communication. So we support effective communication. We teach an appropriate proactive response. We practice and reinforce and generalize this in the community. And we do this through PBIS lesson plans and teaching being safe, responsible, and respectful, and what to say to be safe, responsible, and respectful. Let's say they have sensory processing issues from overstimulation. They're experiencing discomfort, fatigue, increase in stress. We want to be flexible, offer sensory input, empower them with lots of choices. And we want to understand their overwhelmed state and identify how they can let us know or understand what their triggers might be to help them proactively. Failure to manage uncertainty. So maybe they have difficulty with a routine change or a schedule change. So we want to offer predictability, routines, repetition. Maybe they need a visual schedule. Maybe they need lots of proactive reminders. Maybe they need a physical token system that shows him in 5 stars. Then we're going to transition to that outside activity. So they know what's coming. They've got a warning. They're being intermittently reinforced before the transition. And we could even say, hey, when we're going to sit here for 5 more checks, and then you can grab your transition object, something that makes you feel safe. We'll check your schedule, then we'll transition. Let's say they have executive functioning challenges and trouble predicting outcomes or choosing a best response. Well, we're going to do PBIS lesson plans again. We're going to break concepts down into tiny, teachable, simple to understand units. Let's say they have physical pain or trauma. We want to read their records, know their history, know who is high risk for pain. When do they feel pain? Why do they feel pain? How do we support them early? Any risks, choking hazards, walking difficulties, and again, previous trauma. And we can provide supports ahead of time, provide the right supervision, get medical support, simplify and explore their feelings through different conversational methods. Let's say they have learned helplessness. They don't want to participate. Everything's too hard. Perhaps they have anxiety. We want to encourage them. We make these interactions and leisure skills easier. We start small and simple. And we ensure that the individual contacts a lot of reinforcement to help them feel successful. Alrighty. Let's talk a little bit more about trauma-informed care and trauma-informed supports for people with intellectual disabilities. So this lovely PowerPoint was created by Karen Harvey, who's a psychologist in the disability field, a speaker and author. Now, there are many sources of trauma for folks with intellectual disabilities and autism. We mentioned this already: sexual, physical, bullying, exclusion, institutionalization. At Devereux California, we serve adults with disabilities. So for some of them, their families might be aging, or perhaps they've already passed, or perhaps they're just not even visited by family members. So there could also be a sense of abandonment as well. And we have many lovely involved family members. The thing about trauma-informed care is that you want to assume that there has, in fact, been trauma. According to the literature, that is the case for our folks. From betrayal to rejection to social exclusion. For example, not ever being invited to the party. Now, there are big T's and little t traumas, okay? And sometimes the smaller traumas can add up and really have a big trauma impact. One example is even COVID, the global pandemic, losing family members as a result of COVID, suddenly having a bunch of routine changes. Everyone's wearing a mask. There's a lot of scary things with COVID. This is an interesting quote about trauma. Trauma is not even about what happened to you. It's about how it made you feel, and really the loneliness and isolation and processing the traumatic event. What is needed when there's trauma is empathy, respect, and support. We're going to talk briefly about early childhood trauma. Our folks who experience early childhood trauma suffer lifelong impact from that trauma. Okay. It's a little information about a study. What you need to know is that children who are neglected in any way suffer. They might be chaotic homes, parents with various challenges, foster care placements, residential group home placements, staff coming in and out, different experiences. Guys, not all organizations are as amazing as Devereux. They could have had previous very poor experiences. Now, there's a lot of research done on early childhood experiences and adverse childhood experiences. And unfortunately, from those adverse experiences, we see disruptive neurodevelopment, social, emotional, cognitive impairment, high-risk behaviors, disease, disability, social problems, and even early death. There's trauma of racism and discrimination, and PTSD being a spectrum issue. We'll talk about that. Ladies and gentlemen, sometimes the behaviors that we see are really symptoms of post-traumatic stress disorder. There are 4 symptom areas of PTSD, which include re-experiencing, avoidance, negative alteration in cognition and mood, and arousal. So let's talk re-experiencing. They can have intrusive memories, nightmares, flashbacks, where an individual actually disconnects from reality and is convinced he or she is being attacked, hurt, or threatened due to a memory. We see often with our individuals, this could occur around previously traumatic times, birthdays, holidays. Avoidance, they might have phobias, shutdown responses, hypervigilance. They can become obsessive about details concerning self and safety. Disassociation, self-injury, or a selective mutism, blocking memories, and all sorts of other issues. There could be a negative impact in their mood and cognition, such as a sense of impending doom, hopelessness and helplessness, negative views, shame, and self-sabotage. And arousal, hyperarousal, agitation, aggression, property destruction, a startle response, and a need to protect themselves at all costs. So if they feel threatened, you might see someone go to from 0 to 100 in 2 seconds, and you're thinking, oh my gosh, what just happened? There was no antecedent. And it could be a re-traumatizing situation that's now prompting this arousal, and they feel the need to self-protect, and they engage in aggression after that. There's so many different parts of what happens when you have a stress response. Your brain is impacted, your body is impacted, your body sends stress chemicals all over, and the individual is now in fight or flight response. They're in a survival response. So when it seems like a normal and regular everyday life or moment, they could be engaging in behavior from a threat response as if they're being chased by a bear, or this is a life or death situation, and it could have just been a memory. The emotional brain will respond in a crisis or perceived crisis and fills the brain with chemicals. This shuts down the smart brain when triggered and is triggered by both signs of danger or anything that is a reminder of past dangers or traumas. Let's say there was an early childhood adverse event with only males or females. Males who are tall, females with blonde hair, on hot days, in a van ride, and suddenly, here we are in 2025, 2026, going on a van ride, or a new staff has blonde hair, or it's a tall man, and suddenly there's a PTSD response, and staff are thinking, we have no idea what happened. It seems unprovoked. So we must know the triggers. We have to identify them and educate both staff and the person receiving supports and help make a safe and supportive environment. Okay, here's your amygdala and your hippocampus. This is what happens in a trauma response, as I mentioned. There's an activation of fight, flight, or freeze. Your rational mind shuts down, and this is not a teachable moment. You want to catch it before it blows up. You want to get the person away from the trigger. Come walk with me, talk with me, and help the person to feel safe before the incident occurs if you can. So let's talk about what to do when someone is triggered. There's a cool down system, calming, breathing, getting away from a trigger, being safe, providing comfort, giving reassurance. And hopefully people have already identified what helps someone to calm down or de-escalate once they are triggered. And it might be listening to their favorite music, playing mom and dad's reassuring message in their headphones, sitting in a massage chair, some sensory cozy wrap, heating blanket, weighted blanket, taking a little walk, drinking some water. We want to eliminate all power struggles. Again, eliminate anything that could be possibly triggering. And the reality is that executive functioning doesn't work until a person feels safe. So you have to be patient. We want to help the smart brain process, listen. Okay, we're going to hear, we're going to listen, we're going to give empathy, we're going to validate their feelings. We don't want to do a lot of advising, not instructing, and definitely not shaming. Also, sometimes you'll see people want to use a firm voice, and you've got to think, if this person is feeling like they're being chased by a bear and they're in total survival, they're not thinking rationally or logically, their heart is beating, they're completely disoriented, that's not a time to have a really firm voice and prompt more disconnection. We want to provide more warmth and safety. So we never want to control our folks, but we turn into from a caregiver to a supporter, okay? Now, secondary trauma. Staff can absorb pain or trauma of people they're supporting without realizing it. So that's really important, guys. Self-care is important. Take time for yourself. Remember, good week, bad week. Do what you love. Take care of you. By the way, we all come into this line of work with our own histories. Some of us have an extensive trauma history. We have memories we're not thrilled about. We have people that we don't like to work with, and we don't know that it's associated to a person that might have been difficult in our past. So we all have to figure out how to work through our own traumas and how to not bring them into work, okay? At a different organization, I once worked with a gentleman who I came to the facility and he had an individual who was having behaviors in his room with the door closed. I arrived and I said, oh, we can't insist that they stay in their room. That's not supportive. And the gentleman started crying and weeping and saying, I have been heavily abused and I'm not going to stand for this client abusing me also. So what I noticed in that moment is that the staff was re-traumatized, having a re-triggering experience, and is now overreacting with an individual. He was not able to be supportive and care for them with professionalism because he hadn't dealt with his own trauma response. So we need to be aware of our history and how it could sneak in to the role that we have here. Here's some ingredients necessary for post-traumatic recovery: perceived safety, empowerment, and connection. Now, what is safe? Emotional safety, being with people who care about you, preferred staff where there's a really good, solid rapport. No surprises from a housemate, no surprises from anyone, wanting them to know that they're understood and they can safely voice their opinion. Safety is not just physical. Connections, friends who are not paid, real dates, consenting relationships, family members who are safe, access to phone support through computers, the ability to succeed and fail in relationships, and a chance to repair and restore relationships. And empowerment, real choices, not fake ones, real opportunities for growth, the ability to fail and try again, an equitable approach to problem solving, not being a tourist in their own lives or their community, but really engaging. What makes them feel like they're engaging in their community, their religion, friendships, relationships, and genuinely meaningful daily activity. It's a big part of PBIS, which we'll talk about. What activities do they like to do where they feel like they're thriving, excited, motivated, and creative and inspired? And we want them to have a voice that is heard and rights that are real. We want them to have a positive identity, and sometimes that takes us supporting them through understanding identity and what's important to them, holding up a mirror of the best self to that person, pointing out and focusing on strengths, coaching positive experiences through PBIS, helping people feel like they can make a difference, praising character, not behavior. Cute little picture. What matters most is how you see yourself. A little quote here: ultimately, happiness rests on how you establish a solid sense of self or being. Alrighty, we're going to pause here for a quick sec. Okay. See if I can get this right. All right, so what is PBS, positive behavior supports? Positive behavior supports are empirically validated, proactive behavioral approach that focuses on the antecedents that contribute to undesired or interfering behavior. Okay, so it focuses on proactively. What do we need to do to keep hands off, support individuals before there's an issue? The thing you need to know about PBS is that environment influences behavior. Through environmental changes and modifications, we can prevent or reduce challenging behavior. Proactive support strategies are focused on reducing the likelihood that an individual would even need to use problem behavior and allowing the individual to be as independent and successful as possible. Now, the goal, of course, is to increase quality of life. Okay, so modifications can be directed at circumstances that immediately precede behavior. So antecedents, for example, perhaps an antecedent is when staff deny access to something, deny access to a van ride, Coca-Cola because it's in their diet that they can't have it, or longer setting events, longer antecedents, which are called MOs, motivational operations, such as something that happens long before, like a headache, a sleepless night, not having bowel movements, trauma around holidays. Suddenly, here we are in December, we're having behavior issues, and we forgot, oh, we have some MOs and setting events here that typically trigger behavior. Now, strategies should be individualized and based on a functional behavior assessment. Okay, functional behavior assessment is usually when a BCBA goes out, does some interviews, observes behavior, and identifies the whys behind what is this individual trying to achieve, trying to get by using this behavior? Is it access, attention, self-stimulatory, or just avoidance? Here's some examples of proactive strategies. Modifying tasks, reorganizing a physical setting, clarifying routines and expectations, maybe making the schedule visual, helping them feel more intermittently reinforced so that it's not such a long period of time where there's the unknown is happening, so they can receive tokens throughout. Revising an activity schedule, lots of priming and warning, timers, changing social interactions, more choices, enhancing the predictability of the setting, and addressing physiological issues or psychological, mental, emotional issues that could be affecting behavior. Here's a cool little visual about positive behavior supports, what it involves. You've got a target behavior, observation, data collection, function to get X, Y, and Z, or to avoid X, Y, and Z, teaching a replacement behavior, various interventions such as prompting, cueing, modeling, teaching, providing praise and reinforcement, implementing the plan, continuing the process. Here's a little example of types of strategies. For example, when an adult attention is withdrawn or focused on other people, let's say, Lisa makes noises. Her behavior results in the adult talking to her and moving closer to her. Tell Lisa when you'll be available for extended periods. Hey, I'm going to be with Alex now, and interact with Lisa periodically from across the room. That would be a proactive strategy. So another example is when unanticipated changes in the routine occur, Ben throws his materials. Having to pick them up delays the transition to the next activity. Well, a proactive strategy might be provide a written or picture schedule and refer to it throughout the day. Prepare Ben for changes by saying, next, we're going to do XYZ, show him the picture, and remove materials prior to transitions. Here are a couple of examples of replacement skills. So this was the example that when an adult's attention or a staff's attention is focused on other people, Lisa starts to have a meltdown and makes very loud vocalizations. The replacement skill is we want to teach Lisa. So remember, we have our proactive supports where we've primed her and explained, and we're going to practice. Now the replacement behavior is we teach Lisa to ask for the adult's attention or the staff's attention in an appropriate manner, such as, excuse me, tapping someone on the shoulder. Encourage her to interact with peers or get involved in other activities while waiting. Perhaps she needs a token system and rewards to praise her for successful waiting. Okay, there's all sorts of strategies like that. So we want to intervene proactively. We want to identify why they're doing a behavior. We want to intervene proactively, train staff on how to do that, and then teach replacement skills and praise and reinforce. Alrighty, let's talk about PBIS. One thing I wanted to say, so PBIS it's Devereux Positive Behavior Interventions and Supports. Now, this is kind of one notch up from PBS, which is Positive Behavior Supports. Before we get into how Devereux does PBIS, I wanted to take 1 second to describe a little bit about why PBS was developed. So back in the 1980s, a need was identified for improved selection, implementation, and documentation of effective behavioral interventions for students with behavior disorders. So actually, at that time, there were a lot of restraints going on. So there was, individuals had behavior issues, aggression, self-injury, property destruction, and staff and teachers were trying to implement restraints and these types of reactive measures. Well, what was happening is that students were experiencing a lot of injuries, and a lot of challenges, and even to the point where there were some deaths due to restraints, which is why in 1980, it was determined that there was a need for something more proactive, which is PBS or PBIS, to support in proactively helping our individuals with research-based practices, data-based decision-making, school-wide systems, and really looking at organizations with a systems approach. How do we ensure everyone is mostly safe? Teaching instruction, team-based implementation that led to positive outcomes with hands-off. Then in the 1990s, there was the reauthorization of the Individuals with Disabilities Act of 1997, and a grant was established for positive behavior interventions and supports, and it was legislated to disseminate and provide technical assistance to schools based on PBIS, okay? So just a little bit of history there. The reason why this was done, it was created was more proactive supports, hands-off, and supportive and caring instead of very reactive and possibly traumatizing. So let's take a look at our PBIS manual. Guys, PBIS is everything we are, everything we do. What is PBIS? PBIS, this is our manual. I'm just going to glance through it so you guys can take a look at it. Find this in your programs. At staff meetings, your program leaders should be talking about this. PBIS is a staff training program where staff are taught how to create a therapeutic atmosphere in the program, okay? Now, the outcomes expected with creating a therapeutic atmosphere is that as things are enriched and enhanced and therapeutic, undesired behaviors reduce. So people are happy, behaviors go down. That's a good thing. It is a trauma-informed model. It focuses on the strengths of the individual. It's sensitive, mindful, focuses on us being aware. Just like what the previous PowerPoint about trauma-informed care, we create a safe environment. We support consistency, teaching, choice, empowerment, collaboration. Okay. There are 3 tiers of PBIS. This triangle represents how we sort of support all of our folks from a systems perspective. Basically, the bottom tier says that for about, I don't know, 85% of our individuals, they should respond very well to the universal bottom line, sort of tier 1 supports. There's tier 1, tier 2, tier 3, okay? The interventions, the tier 1 supports are interventions and supports available to all individuals. Now, this includes a bunch of elements in the environment. High praise. Do they have the right materials? Are we seeing positive interactions? Are we supporting with enriched activities? Are we scanning, moving, supporting? So that's going to be your tier 1 support, and 85% of individuals should respond very well to that. Now, let's say the next area, tier 2, is you have maybe 10% of people that require specialized interventions with some at-risk behavior. Maybe they have a little self-injury or some communication issues, and it results in some behavior problems. They might need a little brief functional behavior assessment and a brief positive behavior support plan. In addition to the tier 1 supports, high praise, enriched activities, all the other things. Tier 3, these are our folks with the most severe behaviors. These are in our EBSH homes, Enhanced Behavior Support Homes. These are the folks that maybe what did I say, 85, 10. So the last 5% of individuals, they might need comprehensive supports, more staff supports, one-on-one, a comprehensive functional behavior assessment, very structured one-to-one teaching, extensive behavior support plan, and maybe even an emergency plan where we discuss possible restrictive interventions at the last resort. We never want to do them. Okay, so this is our manual. We do want you to get familiar with it. Okay. There's a lot of great stuff in this manual. This section, I don't have a page number, talks about 3 things. You're going to be a relationship builder, an environment manager, and a teacher. Okay. With being a relationship builder, you're going to build trust and influential relationships, which is what we talked about in the beginning of this training. You want to find out what's important to and for them. You're going to advocate. You're going to use high praise. Now, you're going to manage the environment. That means encourage positive behaviors, plan enriching activities, making sure the environment is safe, and conducting effective transitions. And you're going to be a teacher. Through PBIS, we teach lesson plans, or if you're in an EBSH home, you have very specific goals that you work on with your individuals that require very intensive data collection. And you're going to do a lot of teaching. All day long, you're going to do teaching. You're going to teach the individual how to be safe, responsible, and respectful in the van, in the community, at their job, at day program, when they're visiting family at home. Okie doke. So I'm going to move this out of the way, and we're going to take a look at this PBIS question and answer sheet. So every so often, all of our programs are audited on PBIS, and so there are main critical things you need to know about PBIS, okay? So pause this video, commit this to memory. You should have access to this cheat sheet or question and answer sheet. The red text says this. This contains questions that have been historically asked during PBIS audits, and the goal is to help your team feel supported and prepared for a PBIS interview. So you want to note this stuff, test yourself, and make sure you're filling out the exam as you go on. It captures a few main points from the manual, but look at the manual also. But you want to be aware that these are just suggestions. We want to make sure you have some kind of answer. Always refer to the client's behavior plans as priority. That's the best answer. Some of these answers are more generic for maybe individuals who don't have behavior plans or programs where there's not severe behavior. So just keep that in mind. Okay, we talked about what PBIS is. Some examples of, number 2, some examples of Tier 1 supports or the milieu environment supports, high engagement, high praise, pause cards, reinforcement for the individual, having materials, and enriched activities. Number 3, what are the 3 behavioral expectations? Be safe, be responsible, be respectful. What's the goal of PBIS? As we make the environment therapeutic, challenging behaviors decrease, and individuals learn new skills on how to be safe, responsible, respectful. Where's your PBIS manual? It's in different places, but find it in your program. It could be in the staff room, but you need to know where that is, and you need to know where the posters are in your program. There's language in the posters that reminds you what it is. How do the leaders ensure the environment is therapeutic? I could walk into a program right now and listen to see if it's a PBIS environment. Do I hear high praise, positive interactions, person-centered thinking, trauma-informed care, interviews where staff are really getting to know the individuals, making them laugh, doing exciting activities like jewelry making or painting, things that the individuals like to do, okay? Now, how do you respond to challenging behaviors that are not an imminent risk of harm? Remind the individual to be safe or responsible or respectful. Prompt and redirect them to cooperate with a task. Help them feel successful by easier tasks first. Provide praise. Meet any unmet needs and support them to be more happy, relaxed, and engaged. Okay, so if you're seeing any behaviors, this should be documented in my avatar. On the behavior labels section, hour by hour, you have to indicate what the behaviors are and complete ABCs. Now, this one is very important, guys. What is the general way at Devereux that we support behaviors? 3 steps: prevent, de-escalate, and manage, okay? Now, these are suggested responses, and it depends on the individual. How you prevent a behavior or de-escalate for Susie is different than you would for Johnny. And how you prevent or de-escalate with elopement is different than self-injury. So know the individuals in your program. Sometimes you will be quizzed on these questions, and you'll need to know these answers in your staff meetings. and at your PBIS audits. So examples, how do you prevent? So your response to preventing behavior is everything we just mentioned in PBS, PBIS, and trauma-informed care. So your response to prevent any behaviors, you really want to know the individual's triggers. Are they hot, in pain, have allergies? Have they been lonely? Did they just get off of a tough phone call with mom? Is it a holiday? Have they not had a bowel movement? Meet their needs proactively. Use strategies that encourage the individual to focus on things they find motivating, soothing, and positive. Regularly practice coping skills and hand out a ton of pause cards so they can get their rewards. That's how we prevent, okay? Meet the unmet needs before it becomes an issue. Now, number 2, de-escalate. If they're escalated, you have to stay calm. Be careful to not let your own reactions come through. So sometimes when an individual starts having behavior, I see staff kind of brace themselves, or everyone starts being very weird and their faces, everyone needs to relax. Don't overreact. You don't want 300 people running. Everyone, you don't want to, there's an old saying that says, don't let someone's challenging behavior give you a challenging behavior. You want to inspire them to feel more calm and safe rather than their escalation causing your escalation. You do not want that. So to de-escalate, stay calm, remove other individuals for safety, refer to the specifics in a behavior plan for that individual. But if they don't have a behavior plan, position yourself to be in the safety zone or to evade so you can avoid injury to all. And use SMPA strategies to de-escalate. So it could be some calming words. It could be for that individual, helping them go on a little walk. It could be a number of things. Okay. But remember, this is not a teachable moment when they're already escalated. They could be already in fight or flight, and they need to feel safe before they can start onboarding some logic and reasoning. So it's not a teachable moment. They need to feel safe and supported first. Now, if that doesn't work, if you couldn't prevent and de-escalating is not working, and they're still agitated and engaging in problem behaviors, then you need to manage the situation. Make sure everyone is safe. You might have to call the nurse if a PRN is needed, or support staff if restrictive procedures are required. You want to ensure that staff are monitoring all other individuals and eventually support the individual to return to calm behavior. And of course, document. Record your data, document in My Avatar. If there's an SIR, complete the ESI form, which I think is Emergency Safety Incident, in My Avatar and the SIR form. If it's an EBSH, you'll complete a staff and individual debrief form in My Avatar. Make sure you're comfortable asking for assistance, especially if you're dealing with something unusual, something that requires more expertise or monitoring, or more resources, or just if you need a little extra support. Okay? So there's some language in the manual. How do you respond to elopement? Same thing, prevent, de-escalate, manage. How do you prevent? By knowing their history of elopement, know their level of supervision, know their triggers, low visibility areas or times of day that could be triggering or just present too much opportunity to bolt, okay? So prevent, de-escalate, manage. You guys can read through that, pause the video, read through it. Now, how do you respond to elopement off the property? You can pause the video, take a moment to read. If the individual leaves the group in the community, if you're alone, call 911, brief the supervisor. You never leave your current clients alone. You always make sure someone is watching these clients if you need to follow the other, okay? We have a DIRT process, so check that out. That's the Devereux Emergency Response Team. Know the PBIS leaders in your program. Primary leaders are Noelle and James. Let's see, Michelle and Day program, Monica at Wiseman. It's going to be Cece or the BCBA at Foothill, Alvaro Dulce at Somerset, Chris and Megan at Tula. Did I get everyone? James at CASA. I think I got everyone. How do you get a hold of your PBIS leaders? Text us, call us. We have a CASB at devereux.org email. That email is also on the posters. You want to know where your emergency plan is, what it says, where it's kept. Okay, so double check on that. There's a little picture of our org chart. Okay, we got through all the main factors in PBIS. So again, what is PBIS? Staff training program teaches us how to create a therapeutic environment, right? Okay, guys, well, thank you so much for participating in this training. Some of you will go through it much longer. Some of you will be pausing, recording notes, practicing because you do have your exam. Some of you will take a shorter period of time if you're very familiar with this information. Thank you so much. Thank you for being here and continue to nurture and unlock human potential for the folks that we serve. Alrighty, everyone. So we're going to take 15 minutes and review the clinical exam on person-centered thinking, trauma-informed care, and PBS. So you should have received that exam and you should have it in front of you. Hopefully you took notes throughout this course. Okay, so we're going to pause for a quick sec and then go through some of these questions. And I'm going to challenge you on what I would like you to think about. Okay, so question number 1. What is my personal responsibility in maintaining a high clinical rigor at Devereux? So I want you to take a look at all these options, and I want you to remember that this is not a summer job, as we discussed. This is a place where you come and bring your excellence, okay? And at Devereux, we are all about servant leadership, and we are not about doing the bare minimum. Okay, so I want you to think about it. A, this is just a job. I can do the bare minimum, everything should be fine. B, leadership. Be an atmosphere changing individual and nurture and unlock human potential. Remember, I want you to circle all of them that apply, okay? And remember, nurturing and unlocking human potential is part of our mission statement. Person-centered thinking, which is PCT, we want to dig deeply to get to know what's important to and for our individuals, and that includes high praise, enriched activities, and creativity every single day. D, trauma-informed care. What does that mean, right? Assume all individuals have trauma history and take caution to create a supportive, empowering, and safe environment. Understand that behavior challenges might be related to PTSD and past traumatic experiences. So, know their triggers, learn how to identify a re-triggering situation, and help them return to feeling safe. Remember, if someone is dealing with potential re-traumatization, it's not a teachable moment. The only thing to do in that situation is get them to return to feeling safe, whatever that means for that individual. Letter E, do the same exact activities every day, even if my individuals appear bored and disinterested. So no, we want to enrich the activities. We want to make sure they're having a great time. We want to confirm with them that they're having a good time. And we want to probe things, try things. They might not like something, but over time, they might enjoy it. But we do not do the same boring activities every day. Okay, that is not something that we do. Letter F, data and progress. Ensure you're collecting objective and measurable data using ABA strategies to help individuals make progress on their goals. Letter G, PBIS. We focus on high praise rates, high engagement with individuals, rich reinforcement, using visual supports to set our individuals up for success. Letter H, safety and abuse prevention. You have probably heard we are accredited by Presidium, which is all about safety and abuse prevention. So we follow all safety guidelines. We pay attention to signs of abuse or even low-level boundary issues. If you see a staff having boundary issues, we address it. If you see something, we say something. And we want to get comfortable at talking to each other, being like, hey, I know you didn't maybe intend to do that, but here's why we can't do that. It gives the wrong message. We have to be comfortable making things awkward and running it past our supervisor. If we see something, we say something. You want to be aware of high-risk situations, choking, falls, inappropriate relationships, and encourage other staff to do the same. And then the last letter here, I engage in gossip because I don't like a team member. Guys, reminder, we are professionals in this field. Part of your personal growth is overcoming things like engaging in gossip and not being able to create rapport with someone because you guys are different. Your professionalism shows in difficult situations and in maybe, relationships with other people that are different. So, no, we don't engage in gossip. We don't resort to kind of picking on each other or being resistant or oppositional or having poor body language or not communicating well. You want to demonstrate your professionalism. Okay. Number 2, PBIS is a blank training program which teaches staff how to create a blank atmosphere. Okay. So is it a parent training program which teaches staff how to create a good atmosphere? Is it a staff training program that teaches staff how to create a therapeutic atmosphere? Is it a client training program which teaches staff how to create a professional atmosphere? So we're looking for a particular answer, the best answer that we described in this training. Okay. And yes, in PBIS, both staff and individuals receive training. But the whole point of PBIS is to create a therapeutic atmosphere because the literature says as we create a therapeutic atmosphere, behaviors will reduce. Okay. And by the way, number 2 and letter B, what are the 3 behavioral expectations listed on the posters? Well, be safe, be responsible, and be respectful. Okay. And you want to know that. You want to get your individuals saying that. Okay. Let's see here. Letter C. Okie doke. Letter C. What are the expected outcomes of PBIS? And we just talked about it briefly. As you set up a therapeutic, fun, and enriching environment, what happens to undesired behavior? Please fill that out. And I want you also to conceptualize this, guys. Think of the opposite. If the atmosphere, think about it for you, my goodness. If your atmosphere, remember our good week, bad week exercise? If every day, sorry if you guys hear background noise, by the way, if every day you guys are not making choices, you feel like you have no independence, maybe you don't have access to a car, you don't have access to the things you love, let's say your environment is not positive, your environment is negative. How will that make you feel if your environment is boring, depressing? How would that make you feel? And let's say you get no relief over years and years and years. Do you think you would have the best behavior? No, if your environment is negative, you will have negative behavior. It will have that effect on you. And if your environment is therapeutic, fun, positive, what will happen to undesired behavior? Letter D. Again, this is number 2 and letter D. What is my role in PBIS every hour? Now remember, we're talking here about tier 1 interventions. Okay, there's tier 1, there's tier 2, there's tier 3. Tier 3 is the top tiny part of the triangle, and tier 1 is like the bottom line basic supports that everyone does. And what is your role in PBIS every hour? Well, it's doing the tier 1 supports. And do you remember what those tier 1 supports are? Number 1 says, be creative, use high praise, engage individuals in a variety of fun activities. Use visual schedules, help them to know what's coming next. Use visual supports, practice social skills. Are those examples of tier 1 supports? Or number 2, it says, be energetic, but do the same activities every day, regardless if the individual is interested or not. Okay. Number 3 is take the appropriate medical response for medical conditions. Okay. Now, although that's true, that is not necessarily the main role in PBIS. So, which one is talking about the tier 1 basic supports of PBIS? Moving on to number 3. Person-centered thinking involves A, B, or C? What's PCT? Remember, PCT addresses 2 main questions. And what are those questions? So, letter A, is it this? Is it person-centered thinking involves what's most important to caregivers of the clients we serve only, just the caregivers? Is it letter B, what's important to wishes, dreams, aspirations, and for the clients? And again, that for could be skills needed for independence and safety. And how to use creativity to factor those 2s and 4s into every single daily routine, ensuring they are the center of their care. They have control over their care. They have choices over their care. Or is it letter C, fixing undesired behaviors, making sure they do what other people want within 3 to 5 seconds? Which one is PCT covering? A, B, or C? Number 4, in PBIS, how do I address challenging behavior challenges at Devereux? What's the main way we address behavior challenges? Is it A, B, or C? And you guys have to really think logically here. Do we de-escalate, manage, prevent? Do we manage, stop it, and prevent? Do we prevent, de-escalate, and manage? Okay, I want you to think through back to the training here. Number 5, the following is a description of PBS. Circle if it is all true or all false. Okay, so the quote here says PBS stands for Positive Behavioral Supports. It is an empirically validated proactive behavioral approach that focuses on the antecedents. So that's what comes right before the problem behavior. And it focuses on the antecedents which contribute to undesired and interfering behaviors. Now, PBIS seeks to improve QOL, quality of life. And remember, environment influences behavior. Proactive support strategies are focused on reducing the likelihood of problem behavior and allowing an individual to be as independent and successful as possible. Okay, is that all true or all false? We have 2 more questions here, my friends, and we are done. Some of you might speed through this section a little bit, but we're just helping you with the course exam. And you have to turn this in to be given credit for the full 2 hours, okay? And again, the EBSH requirement is 5 hours of annual CEUs. So that includes this 2-hour video, and then the 1-hour cultural competency every year. And then there's 2 separate PBIS courses that are in your learning portal, okay? All righty. And actually, let me see if I can remember which of those courses are, which ones they are. Okay, maybe I can take a look at that in just a moment. Okie doke. So I took a look there, and the 2 PBIS courses in your learning portal are visual supports and lesson formats. So sort of how we teach lesson plans. And again, it's not the same for everyone, but it gives you an idea, if you have a client that's more vocal, of how you want to practice something. If you're teaching a skill to someone that is non-vocal, it might look a little bit different. Okay, now our last 2 questions. I want you to circle true or false for number 6. So the following is we're kind of going back to here talking about this question, which is how do I address behavior challenges at Devereux? Prevent, de-escalate, manage. You want to think about what that means, okay? When we're preventing behavior, well, how do we prevent it? Well, you have to know your individual's triggers. You know their trauma history. You know how to de-escalate them, what worked and what didn't historically. So the first thing that you're going to do is try to prevent the issue by meeting any unmet needs. Sorry, pushed the wrong button here. Meeting any unmet needs. If there are certain things that are triggering for them, certain times of day, certain times of year, perhaps always around the holidays and their birthdays, in hot weather, they tend to be triggered. You are going to support proactively with how to make sure that they're enriched, more comfortable, have more support. If they have behaviors when it's hot and you know you're going on a hike, extra water. Maybe they want to, cool down in some ways. Maybe they have a popsicle. They're not overdressed. You're checking in frequently. They have to touch visuals if they're not vocal to say that they're doing okay. Prevent, right? You have to know what the sensitive issues are in order to prevent. And then again, de escalate. Well, how do we de escalate? We have to know again what has worked historically to support them to de escalate. And again, this is assuming with de escalate that preventing it didn't work. So, say preventing it didn't work, they're continuing to escalate, and you have to de escalate them. So, they're already up there. This is not a time for teaching. This is what helps them calm down. And in this time, you're also staying in the safety zone. You're being cautious. You're being careful because they're exhibiting behaviors. And so, perhaps addressing any need at this point. Hey, how can I help? What do you need? So we couldn't prevent it, but now we're having behaviors. What do they need? Is it a heating pad helps them calm down? Is it a head massage? Is that in their behavior plan? You're always referring to the behavior plan. How do we de-escalate? There are certain things that you should know that trigger it worse. Perhaps having a very firm tone triggers that behavior to get worse. Perhaps you feel anxious because the individual is escalating and you start escalating. And so then you have very weird posture. You have a very stern face. That can contribute to more escalation. So you have to know what de escalates that individual. In general, staying very calm, talking in a neutral voice, being very supportive, trying to get to the thing that helps them, their body get more regulated. Now, remember, they could be exhibiting PTSD, and that's why they're escalating. But what pulls them out of that? Hey, bud, let's go take a couple of laps around. Let's drink a cool glass of water. We're going to move anything out of the area that could be dangerous. Perhaps they throw chairs. Perhaps there's some toys that they could throw. So you want to make sure the environment is supportive. And again, what de-escalates them? And then managing, that's going to look different, right? Prevent, de-escalate, manage is going to look different for every individual and every behavior. Prevent, de-escalate, manage will look different if we're talking about elopement. It will look different if we're talking about aggression. It will look different if we're talking about self-injury. And what is correct for one person is not necessarily the right approach for another. But then again, in step 3, when we're managing behavior, we might need to get support from a supervisor. We might need to do an emergency crisis intervention, a restrictive intervention, which is a restraint, which we try to avoid at all costs. But if the individual is in imminent harm and there's no way to avoid this and prevent and de-escalate didn't work, then we might have to manage the situation. So we're calling for support. We're making sure all the other individuals are safe. Perhaps they need a restrictive intervention. Hopefully not. And then again, we don't just start there. We help that individual all the way back to their calm. All the other individuals are calm. That's managing the whole environment, the whole situation. So number 6 and number 7 are about that. Circle true or false for number 6. The following is a good example of preventing self-injury for an individual who is non-vocal, so they can't speak, and they have a history of self-injury when he is hot. Okay, so you got to think about that. They're non-vocal. There's a history of self-injury when he's hot. Perhaps he hits his head. So letter A, is this a good example, true or false? Take water or ice packs out on hot days and hikes. Check in with the individual every 15 minutes or more often on the hot day to ensure he's hydrated and comfortable. Look for any early signs and symptoms of overheating before there are behavior problems, right? Do they have a red face, slight perspiration, a decline in mood? And remove excess clothing. Bring a battery-operated fan to keep the individual cool. True or false? And number 7, true or false, is the following a good example of preventing self-injury for an individual who has a history of, preventing, delete this, preventing aggression I got a little error there. Glad I caught that. Preventing aggression, such as hitting her head. For an individual who hits her head. Thanks for bearing with me here. When she has a headache. So she tends to get headaches in the afternoon right around shift change. So is this a good example? Train all staff on how to support Susie proactively leading up to the afternoon. You don't kind of neglect the needs and see what happens because we know she struggles in the afternoon. She is inclined to not feel her best, so we want to ensure she's well hydrated. She ate her lunch. She's in a good mood, maybe happy and laughing. Staff should make sure they're not too noisy at shift change and give Susie minimal task demands. You don't want to be too complicated. And you want to think, what is it about staff change that possibly leads her to get a headache or leads her to feel overwhelmed and start hitting herself? Could be that it's noisy. Also, early, remind Susie that she can tell us staff if she needs medication if she has a headache. Check in often and encourage Susie to do activities that are motivating and relaxing in the afternoons. True or false? So, thanks everyone. Hope that helped to take you through your clinical exam. Turn that in and you will get credit for your 2-hour training on trauma-informed care and PCT. Thank you so much.